Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World, and let's just talk. Are you prepared to cover a surprise medical bill? The American Heart Association explains how the No Surprises Act is protecting families from surprise medical bills, plus a new survey that shows that most patients support the law to protect them from unexpected medical costs. Our guest today is Dr. J. Carter Ralphe, a tenured professor and division chief in the Division of Cardiology and the co-director of the Congenital Heart Program at UW Health Kids. Ralphe is a longtime volunteer for the American Heart Association, where he sets nationwide advocacy priorities as a member of the AHA National Advocacy Coordinating Committee. I want to welcome you to our show, Doctor. I'm so honored to have you. Tell me, so many people are worried about medical bills. Can you talk about how this new surprise medical bills harms patients?
Yeah, absolutely. Thank you. You know, surprise medical billing has been going on for quite a while, of course. And this No Surprises Act, which has been in place since 2020, is really trying to protect patients from this. This happens when a patient receives care from an out-of-network provider that they thought would be covered by their health insurance. And a great example of this, the classic, is if I go into the emergency room with an emergency, a heart attack or stroke, or God forbid, something else, and I'm receiving life-saving care from a whole team of people. I don't know who's in network and who's not. And there very well may be folks who are being used by the hospital, employed by the hospital to provide care for things like anesthesia or radiology readings or et cetera, that are not within my health insurance network. And when I get home and the bills are rolling in and health insurance is processing and handling most of it, there may be these outlying bills that can be quite large from these out-of-network providers that I am responsible for fully. This can amount to hundreds, thousands, even tens of thousands of dollars, and throws patients and their families into financial crisis, and it leads some to actually avoid seeking care altogether.
Well, how is the No Surprise Act protecting patients?
Yeah, the No Surprises Act has been doing a great job of this, actually. It was passed in 2020 by Congress. It received great bipartisan support. This is not an issue of Democrats and Republicans, it's all of us. And it also had strong support from the American Heart Association as well. And this actually prevents this type of billing from being passed through to patients. It protects patients directly against this billing. Going into your ER, going into your outpatient clinic, going into your ambulatory surgical center. If, again, God forbid, you need transport by air, by a helicopter and airplane between one hospital and another, that's an enormous cost. That used to get passed on in many cases directly to the patient. This act, the No Surprises Act, protects patients from being billed directly for this cost.
And there's so many times when actually somebody gets cancer, or somebody has a heart attack, whatever, and they get one of these bills, and if you feel like you're having the other person feels like they're having a heart attack when they get it, right? So why, and I know this, why is it so important to keep the No Surprise Act in place?
Yeah, I think it's doing exactly this. It's preventing these, jaw-dropping charges that cause tremendous stress and throw families into crisis, financial crisis. It's keeping that from happening. And it's really allowing folks to have more confidence that if they need it and they need care, they're not going to be thrown into financial destitution. And as you said earlier, the polling shows that over 3/4 of Americans support this act, and 6 out of 10 people are very worried about the debt associated with medical care. And this act really helps mitigate that.
Well, I think I might suggest something that we contact our congressmen and senators and say, we want this act to be protected. What do you think about that, Doc?
I think that's great, but I also think that the American Heart Association is also a good ally in this. They have the resources and infrastructure to really help lobby on our behalf, and it's on behalf of us, patients, right, trying to get care. And so a very simple thing your listeners can do is join the American Heart Association's efforts to protect patients, and by texting the word surprise, 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 to 46839. They just text the simple word surprise to 46839. And join with others in the American Heart Association in really protecting patients from surprise medical bills.
And I think that's so important. I know that the last time I went in, had some orthopedic stuff, and the gal said, guess what? You don't have to pay anything. And I went, oh my gosh, that's wonderful. Probably because of this act that made it easier for me as I don't like to use the word senior, mature person. Do you know what I mean? And a lot of us that are
increasingly
mature people want to be protected so much more. So I want to thank you. Go ahead, doctor.
No, I also want to say that if you do get a bill that you don't agree with, that you think is unfair, there are resources that are very important to be able to reach out to. And the Centers for Medicare and Medicaid Services actually has a hotline, which is 1-800-985-3059. It's 1-800-985-3059. That hotline is set up. It's a help desk to help you manage this. You can even go online. Very simple. It's cms.gov/no surprises and get direct help in mitigating and helping with these bills if they should come through and you feel they're unfair.
Right. I really appreciate that. And I know my audience probably appreciates it very much because, a lot of times you never know. And I just happened to be with someone the other day and she said, do you know that I had a heart attack in January? And I went, no. And she said, and she's a lot younger than I am. And I was really surprised, but she said, you can't even imagine what I went through. And I said, I try to because, half my family have heart problems. I'm lucky I don't, Doc, but that happens. So where can we get more information again, doctor?
You can get more information directly from the American Heart Association, right, by texting surprise to 46839. And incidentally, if you're worried about heart disease, which all of us should be on some level, the American Heart Association's website, the AHA's website online, has a tremendous amount of resources to help understand how you can lower your risk for heart disease and stroke and even live a longer, healthier life. So it's a great resource as well. But then also, if you're struggling with unexpected bills, you can call the No Surprises Help Desk at 1-800-985-3059 or just email them directly at cms.gov/no surprises.
Can I have that last part of that telephone number one more time?
Yes, of course. It's 1-800-985-3059. They're manned 8 to 8 or woman 8 to 8 Eastern Standard Time, 7 days a week.
I want to thank you for your mission and your volunteer service for the American Heart Association, and keep us healthy, doctor. Thank you so very much for joining.
Thank you. My pleasure.
On Kathryn Raaker's World. Thank you. And don't forget to go to our website.
Thank you.
KathrynRaakersWorld.com.